In this small group session, the participants playing the clinician interview a simulated patient who is given clinical information as well as information about underlying psychological factors that may be affecting the illness. In the first simulation, the patient is a professional woman with abdominal pain. In the second simulation, the patient is a man with Crohn's disease presenting with a new pain. In both situations, the clinician is able to elicit an underlying secret. There is an opportunity to observe the interaction and determine what factors allow the patient to disclose their secret.
Doesn't look like a 64-year-old male. Hi, I'm Donna Gutterman. How are you today?
How do you do?
And your name is?
Deborah Rewcastle.
Deborah.
Yes.
Please have a seat.
Yes.
So what brings you here today?
Well, I've been having some pain, and it's not going away. And I've had quite a few tests now, but I really need to take care of this.
Help me understand, where's your pain?
It's right here in my belly, right on top of my belly.
Okay, and how long have you had it?
I'd say it's been 6 months now.
Okay, and is that the only problem that you're having, is just the pain?
Well, yes. Well, what do you mean?
Well, you just said that you were having some pain, and so I was just wondering, is that the only symptom you're having, just some pain in your belly?
Well, yes. Yes, that's right.
Okay, and I understand, have you seen someone about this pain?
Yes, I saw a gastroenterologist 3 months ago, and I had all kinds of testing. You want to know a little about that?
Sure.
I imagine it's on my records, but I can't tell you very, very concisely, but I had a urinalysis, I had ultrasound, I had all kinds of blood testing. They looked at my liver, kidney function. They went down my throat, to look. And they gave me some triple medicine to take it away, the antibiotics. I believe it was called triple antibiotics. I've not had relief.
You've had no relief of the pain here in your stomach with the antibiotics?
Really not. Really
Okay.
not.
And have you tried anything else for the pain?
I had antacids, I had a pump of some kind, or something, and I had Zantac. I've had a new medicine now. I tried one of them and then 2 of them, Prilosic, I believe it's called. I do not know why we cannot fix this, doctor. I'm hoping that you are going to be able to, deal with this pain. It's really interfering now.
Does the pain affect you in your day-to-day activities?
Yes, it does.
Tell me more about that.
I had to leave a meeting just the other day. I was in so much pain. I could not even stay through this meeting. That's not suitable for my position.
What did you have to do?
I had to leave the room. I had to go and lie down.
Did you go home?
I did.
Okay. And how long did it take for the pain to go away?
It doesn't go away, doctor. It's a little bit better sometimes, but it does not go away. It's just about constant.
If you were to rate your pain on a scale from 0 to 10, where 0 is no pain and 10 is the worst pain you've ever experienced, how would you rate your pain?
Sometimes it's a 4, sometimes it's an 8.
What is it most of the time?
Right in the middle, maybe 5, 6. It's tolerable. It's tolerable, but it's distracting me.
So when it's a 5 or 6, are you able to work and do things?
Yes, yes I am, I have to, but it is distracting, I'm not able to focus as sharply as I have been all these years.
And when you say distracted, what does, and not able to focus, what do you mean?
Well, I don't know, I guess I'm moaning half the time, just, you know, I don't know if you've ever had such a thing. I guess it's like, kind of like cramps, you know, you can do your work, you can function, but you're hurting all the time.
Do you feel like you can get as much work done when you have your stomach hurts at a 5 or a 6?
No, I can't get the same quality work done, I'd say. I can get my work done. It's harder to really throw myself into it the way I always have. Very frustrating.
Well, you know, I think we can certainly work at this and I'd like to stay with you and work on this to see if we can get your pain relief. If we could get this pain reduced, maybe even half of where it is today, is that something that would be of value to you?
Oh, yes, absolutely.
Okay. All right.
Yes.
Well, we will work on that. I'm not sure where else to go.
You were pulling it all out from your
Yeah.
fast learner.
Yeah. I was paying attention earlier. Okay.
Evidence.
Very good.
How did it feel?
She was very good. I mean, it felt good just, you know, sort of lobbing a question and then trying to be very quiet about it because she was a great patient and easy. It would seem to be a relatively easy patient. She did want to talk about what was going on. So that, I mean, it felt okay. I'm not sure where I'd know where to go to help her, but just chatting with her, I felt I could understand what was happening with her.
Were there things that you would like to know more of?
You know, I think, I'm trying to think what I might, you know, in the moment I can't quite acknowledge what I missed, but I think she helped me very much understand how debilitating this is and the impact on her activities of daily living and just the impact to her work and to her life. You know, I realize now I delved into nothing that might be precipitating any of this for her or anything that's exacerbating this for her. I realize that now. But, yeah.
Yeah, she did give a couple of clues about there being stress or other issues
Yeah.
at work that she...
And I went right over me. I realized that.
But you did a remarkable good
You
job.
did good. Let me ask you, I don't know if people are not, do you want to go back into your role and try
Should we get more
explore?
suggestions from the
Yeah,
board
let me,
here first?
Yeah,
Yeah.
I just can't know how much time. Okay.
Well, I loved when you asked to rate the pain. I thought that gave her, you know, an opening to describe the pain. I thought that was excellent. And tell me more about that. This is the phrase you used. You mirrored her placement of the pain. So there was some visual. You did that twice, actually. I wanted to understand, help me understand, because I'm supposed to be watching the verbal. What did you mean? You asked her more questions to get more information.
And a really nice tone of pace too. I really thought your pace, just in terms of, like, you know, Amina was talking about synchronization. I thought yours was very good, actually. You know, your tone of pace was really relaxed. Like, I felt really relaxed as I was just listening to your interview. And, you know, your nonverbals were excellent. You were leaning forward. You were nodding some. You were using some hand gestures, especially to sort of illustrate some of the concepts that you were relaying. I thought that was excellent. And again, I think the introduction was really good. I thought that was really nice the way you asked her name, and shook her hand, and I think I suspect that really put her at ease at the start of the interview.
Okay.
Anybody else?
Others?
I think you did so many things right. I would wanted to see in the very beginning a little more open-ended questions. You said, where is the pain? You narrowed down quite a lot, the beginning.
Yeah.
That's my only thought right now,
Okay.
improvement.
That was
How about
great.
you as a patient, your feedback?
Shall I give it in character? All right.
Do you want to give it now or after she continues?
I have thought it too might help.
Okay.
Okay.
I'll stay in character though. For me, the way you were asking me, you did ask me over and over something. I thought maybe if you summarized, you would show me you got it about the work and about the distraction. It seemed like that question kept coming, as opposed to, I got that, what else? How, what do you think it is? Or tell me about what you eat, or tell me about when this started, tell me about what your stressors are at work, because it is connected to some degree to stress, although there can be other factors here. You might suggest some other things that could be going on, so I could all of a sudden say, oh, that one sounds right, and allowing me to explore, getting me leaving some more silence. I did love too your pace, your openness, your presence with me. Didn't feel like get out. Felt like let's talk until we figure this out. More specifics maybe would get me somewhere.
Okay.
You gave a lot of nonverbal cues. That was my job. Your nose flaring, that's just sign of frustration, and also these kind of hand movements. You're trying to exhibit frustration.
Was it in her, so I can't even remember it, was it when she was talking about her condition, or was it in response to me not asking something?
No, it was when she was starting to talk about how it was affecting her work.
Okay. Thanks. So, we're gonna keep going, is that?
Just for 2 or 3 minutes, just to transition of what you said you wanted to find out a little bit more about.
Okay. All right, so, I forgot what you told me your name was.
Ms. Bukowski.
Miss Bukowski. Okay, Miss Bukowski, you mentioned earlier that this started about 6 months ago,
Yes.
and that it oftentimes makes you leave work. Talk to me a little bit more. Does this happen mostly, does the pain get worse when you're at work?
That's an interesting question. I think to some degree, yes, but in the evening I suffer as well.
What's going on in the evening that you notice? Is there anything that's happening that you notice when you tend to suffer a little bit more?
I've been, because the medicine hasn't worked so well, I've been using a little alcohol. I don't know if that's right.
Sorry. Threw me. Okay. My apologies. So now I have failed as a physician. Okay. In the evening, you've been using a little bit of alcohol.
I do. I'm sure that is not helpful to my situation, but
How often do you do that?
I do it a lot now, just recently. And I could stop, but I been getting any other help except this, so I know it's not good.
Now, help me understand when you say it's a lot. What does that mean?
I have a couple of drinks a night,
Is that every night?
just about.
And how long have you been doing that?
Just maybe 6 weeks or so.
What do you drink?
I have vodka. I make a martini for myself. It's a lot of vodka and mostly nothing else. It seems to, I don't know, ease the pain a bit, and it seems to just, you know, how you feel when you have alcohol, you kind of feel like things don't matter so much.
Do you eat when you're drinking?
I have some supper eventually, yes.
Okay. Well, all right, so that's something else I think we can work on as we can work through this problem with your stomach and the pain.
You know, I have had to drink socially forever. I mean, I take people out to lunch all the time, and I can hold my liquor at lunch, you know. But this is not social.
Have you been drinking for a long time?
Well, in my work as a, research marketer, I travel all the time. I have lunches and dinners with clients all the time, and almost always one has a drink, sometimes two. But I've been fine with that.
How long have you been a research marketer?
I've been doing this for 30 years. I love it. I love my work.
Okay.
I don't want to have to change anything there.
Okay. So now I have an alcoholic. Okay. Hi.
So Kelly.
Nice to meet you.
Lori. So, what are you here for today?
Well, I don't know if you saw the stuff my intern sent over, but I have Crohn's disease. Had it for a long time.
Okay.
Been pretty well managed for a long time, but recently there seems to be, I don't know, some change in my condition. I'm not really sure what's going on, so I just need to
Okay,
find
so
out.
there's a change?
Yeah.
Okay. What do you mean by change?
Well, I've had, recently, this is just last several weeks, developed this kind of chronic discomfort. I'm not sure pain is really the right word, but
So the pain, tell me about the pain.
it's just kind of this dull ache. It feels like some heaviness. I don't know. I'm not good at articulating this stuff.
And it's been going on for how long?
I'd say 3-4 weeks.
And does anything make it better?
Not so far.
Anything
I want you to make it better.
Sure.
Okay.
Yeah, I'll definitely do that.
Okay, good. I appreciate that. That's
Does
why.
anything make it worse?
No, not really. It just kind of seems to, just a new part of my life.
Okay. So, you have Crohn's disease.
Yeah.
You've had that for how long?
20 years.
Okay. Any changes to your medications since this change started?
No, I've been on Lialda it's been probably 5 years. So, no.
Okay. And anything else going on in your life? Do you have any stress or anything bothering you?
Oh, who doesn't have stress?
Lots of people have stress.
Yeah. Yeah.
What are your stressors?
Well, I travel a lot for work. I'm away from home a lot. I guess, no, I don't know. I guess just kind of normal stuff, relations to
but it's not too bad.
I don't know, probably, I mean, what's the
Yeah.
plan, right?
Let's stop here for a second, so we can get some feedback and then do something different.
You're really harsh.
Yeah.
I'm trying.
That was
I'm trying.
That was
Okay.
excellent.
You did a good job of being bad.
I tried to interrupt a few times and kind of skim over stress. Oh, everyone is stressed.
How did it feel for you?
Uncomfortable.
Why?
I felt like he wanted to say more, but I wasn't really allowing him to say more. He wants to talk about travel, he wants to talk about work. He didn't use the word pain, but I kind of went straight for, oh, you have pain, how bad is it? How long is it there? Without actually using his terms or his description of it.
You didn't introduce yourself.
Yeah.
Can we ask the patient, how did it go?
Not fun. As though an inconvenience, my being here is inconvenient. That's, yeah, as though I wasn't being asked things that mattered, or I wasn't being treated seriously.
I also tried to move the chair away.
Yeah, it was the first thing you did.
Yeah.
Is what you said.
To try to get further away.
And you lean back.
Yeah.
And you crossed your arms.
I tried to not look at you, but that was hard. I didn't really look away as much as I.
So can we all give some advice? So what are the top 3 things you can improve from your homeworks, guys? From our homeworks?
Body language, to really be forward and interested and,
Acknowledging, like, actually, you were, if anything, you were dismissive, right? And purposely, you could tell, but that's like, those 3 things that Crohn talked about this morning, acknowledging, hope. You get to the other 2 things later on, but certainly the first thing.
Also, when he said he wanted me to help him get better, I just said, straight up, I'll make you better. Not, we'll work together as a team to manage your symptoms. None of that. It was just, yeah, that's what I do. That's
And then you smiled like, yeah, sure, this is good.
that was accidental, but
So
yeah.
it was premature assurance and also
Sure.
really was unclear whether you're joking or not. Quite inappropriately so, right?
Yeah.
So do you want to try and replay?
Sure. Hi, I'm Kelly.
Hi, Kelly, I'm Rob.
Nice to meet you. What brings you in to see me today?
Well, I have Crohn's disease, and it's been pretty well managed. I had it for a long time, but recently I feel like there's some new stuff going on, and I don't really know what it is or what to do about it. So,
Okay. Can you tell me some more about that?
yeah, this is really just the last several weeks. I've kind of developed this kind of dull, achy discomfort.
Okay.
I don't know. I've had flare-ups before, and when I do, I get prednisone and switch the medication for a few weeks, and it seems to be fine. This doesn't feel like anything I felt before, so I'm a little concerned.
Okay. So I'm hearing that you're having a discomfort,
Yeah.
and it's different from what you've experienced previously.
Yeah.
Okay. And you said it's been a couple of weeks?
Yeah, 3-4 weeks, something like
Okay. Any other changes going on over those couple of weeks?
that. No, not really that I'm aware of. It's a little embarrassing, some of this stuff, but I seem to be having a little more diarrhea. But other than that, no, I feel
Okay.
like a reasonably healthy person.
What do you mean by diarrhea?
I'm sorry?
What do you mean by diarrhea? A lot of people have different
Oh, it's
thoughts.
just kind of, very soft, sometimes runny. Never had to describe it before.
Okay. The discomfort, where is it located?
It's kind of right in my butt.
Okay. Can you tell me about the first time you experienced the discomfort?
No, I mean, I really wasn't paying that much attention. I mean, it just kind of like was there and won't go away. I mean, it's, everybody has aches and pains, right? So I didn't give it a lot of focus until I noticed that it was kind of, I was living with it.
It was kind of,
Chronic, I mean, it wasn't going away.
okay. How is it affecting your daily life?
I don't know that it is in a huge way, except that, I'm concerned about whatever caused a change, what the change indicates. Is my Crohn's getting worse or doing something? Is there something new going on? Do I have some kind of, in fact, I mean, I'm worried about my health. Is there a change? And so, that I'm probably feeling a little stressed. I don't know. I mean, I'm able to do everything that I've always done. I'm able to work. I'm, functional. But whatever's going on, is it going to get worse? What is it?
Yes.
Yeah.
Sounds like it's concerning you.
Yeah.
Okay. Is there any additional stress at home or at work?
No, not really. I mean, my life really hasn't changed in any sort of like documentable way.
What do you think could be causing this change?
Well, it's a little hard to talk about. I'm on the road a lot. I'm a consultant. I travel pretty much constantly. And my lifestyle when I'm away from home and my lifestyle when I'm here are pretty distinct. And I'm wondering if maybe I've done something to cause whatever's going on. Maybe I've injured myself somehow, or maybe, I don't know. I mean, I don't know. I'm sorry, I'm having trouble.
No, that's fine. Could you tell me a little more about what you mean by distinct?
I guess I have to know that what I say in this room is not going any further.
Of course.
Okay. I have here I'm married. I have 2 kids, kind of a normal guy, When I'm away from home, I have different inclinations. I have relationships with people other than my wife, with men. I'm wondering, these days there's always some nervousness in the gay community about diseases and infections and injuries, and wondered if I did something, if I'm somehow, if I did something. And I don't know. I mean, I want the answer to be no. So
Okay.
that clarifies the
Well, I
statement.
appreciate you being open and discussing your concerns with me. We're going to do a physical exam and we'll evaluate those concerns today.
Okay. Can I ask you, I mean, I have no idea, could what I'm feeling just be a a variant on the Crohn's? Could it be, just a different kind of inflammation or something? I mean, could it be as simple as that?
It could be. It could be related to the Crohn's. It could be just a concern that we need to discuss about your feelings with this distinct life that you were discussing.
Okay. What else, I mean, if we're going to do a physical, what else could we be talking about here?
You discussed concerns about injuries, and
Yeah.
that's also something that we can look and evaluate during your physical exam.
Okay. All right.
Up here? Well done. Let's ask the patient first, how did it feel?
Well, it definitely felt better. I felt I was being listened to much more directly. There was much better eye contact. There was a lot of that nodding going on, which I really appreciated. But mostly felt, I don't know if reassuring is the right word, but what mostly felt good was that I was being given all the time I needed to say the things that were hard for me to say. And that there was no sense of my being judged or looked down on because of anything that I did. So it became progressively easier and easier, and I really appreciated your using the same vocabulary I used. That that I wasn't being pressed to go someplace that I didn't want to go. So I thought I liked person B a whole lot more.
You used the distinct lifestyle, you gave him a signal, I did hear you. I did hear exactly what you said. How did it feel for you?
It felt good. I was a little torn between the awkward silences and wanting to say, "Oh, it's okay." I didn't know when it was appropriate to just continue saying nothing or to reassure. I felt a little torn there.
What would you say would have been better? The silence or reassurance?
For me personally, the silence was helpful. Now, I don't know that would be true for everybody, but I felt as though I came in needing to say certain things, and it wasn't the prompt, it was the opportunity.
Yeah.
Again, for me.